Hello, my dear. I'm Dr. Alaa Mosbah, Professor of Obstetrics and Gynecology, Faculty of Medicine, Mansoura University. Our lecture today about Ptyalism Gravidarum, or sialuria during pregnancy. Okay, this is a very important subject because it may cause irritation to pregnant women, especially during early pregnancy in the first trimester, and may extend all over the pregnancy. Okay, due to increased secretion of saliva. Okay, so this lecture is important for obstetrician and also for pregnant women. So what are the objectives of this lecture? To know the definition of Ptyalism Gravidarum or sialuria, the epidemiology, the pathophysiology, clinical presentation, diagnosis, and outcomes and prognosis, and lastly the management, how to treat such case. Okay, let's start with the definition. What is Ptyalism Gravidarum? This is a rare condition affecting pregnancies, characterized by an excessive production of saliva. So there is increase in production of saliva during pregnancy, especially in early pregnancy. Okay, this is called Ptyalism Gravidarum or sialuria. Okay, so what about the epidemiology? Is it very common condition? No, it is rare condition. However, there is variability between pregnant women according to their locations. So you may find incidence in some countries more than others. Overall, it is affecting about 0.05 up to 0.3% of all pregnancies. It is commonly associated with nausea and vomiting during first trimester, from mild morning sickness to hyperemesis gravidarum, which is hazardous, symptoms of gastroesophageal reflux disease, as well as other eating disorders such as anorexia nervosa, bulimia, or Pica syndrome. Okay? Pica syndrome, one of the nutritional disorder where the woman may eat something not food. The subject is not food. Okay? And this is usually associated with mental disorder. Bulimia, eating much more food at certain times and try to get it out. Okay, this is a bulimia. So this condition of increased salivary secretion may be associated with nausea and vomiting, especially in early pregnancy. This nausea and vomiting may be severe enough to cause hyperemesis gravidarum, or may be associated with symptoms of gastroesophageal reflux disease or other eating disorder. Okay? It may be more frequent in women with family history of the disorder. So when you are taking history from a pregnant lady, ask about this. Is there any family member complaining of this during pregnancy? And ask the patient herself, do you have symptoms like this in a previous pregnancy? Because it may be recurrent. Okay, so it is a problem related to pregnancy in the form of increased salivary secretion, and there could be a positive family history. Also, in psychological patients, it is more common also. Such a condition may happen in psychotic patients. What about multiple pregnancy? Multiple pregnancy may increase the risk of occurrence of Ptyalism gravidarum, and the male fetal gender are possible risk factors. So multiple pregnancies. Also, male fetal gender considered risk factors. Is there any association with the maternal age, either young or older? No, there is no relation to maternal age. So the proved risk factor is up till now, or the possible risk factor, multiple pregnancy, the male fetal gender, psychotic patients, positive family history. Okay. What about the pathophysiology of this problem? The pathophysiology of Ptyalism gravidarum is unknown up till now. Some authors consider it may have psychological origin. Others believe it has an organic explanation. Okay? Which is true, up till now we don't know. But you should know that its higher prevalence during early pregnancy suggests a hormonal effect. High HCG, progesterone, and estrogen levels may play an important role. So, what is important information you should know? Also, that the secretion of saliva is regulated by autonomic nervous system and highly stimulated by the parasympathetic nerves, which increase the amount of saliva produced. So, when there is vagal tone increased, there is increased amount of saliva produced. So, this condition highly stimulated by parasympathetic nerves. Parasympathetic nerves is responsible for the secretions of the saliva, the increased secretion of the saliva. Okay? Okay. What else you should know? You should know that the vomiting center and the salivary control area are anatomically close. So, what is the benefit of this? All these features support a common etiology to nausea and the sialorrhea during pregnancy. So the vomiting center and the salivary control area are anatomically close. And this suggests why, or try to prove that there is association between nausea and the vomiting and the sialorrhea during pregnancy. Okay? So what about the clinical presentation? Ptyalism gravidarum described as excessive salivation up to 2 liters per day. So what is the average? Normal average in adult, less than 1 liter per day on a healthy, non-pregnant adult. But in case of Ptyalism gravidarum, there is excessive salivation up to 2 liters per day. It begins during the first trimester of pregnancy as early as the 4th week, and it may improve with time or persist until the end of pregnancy or some weeks postpartum. So, this condition start early in pregnancy, as early as the 4th weeks pregnancy, okay, and extend up to the second trimester. Improvement may happen or may extend all over the pregnancy and even 1 month postpartum. Patient may struggle to swallow the high amount of saliva requiring spitting cups or paper tissue to dispose redundant saliva. And the accumulation of saliva may cause speech impairment, and the patient may have deep, may have sleep deprivation. She can't sleep very well because of this excessive saliva in her mouth. Significant emotional distress and social difficulties. Imagine a pregnant woman working in a hospital or whatever, and all the time there is excessive saliva, excessive secretion of the saliva, and she can't swallow it. She needs spitting cups or paper tissue to dispose redundant saliva. How can she do her work? Well, while she is complaining of this. How she can deal with others while she is complaining of this. So this condition irritating any pregnant woman, either due to sleep deprivation, significant emotional distress, and social difficulties, and speech impairment. There may be some associated symptoms like nausea, vomiting, anorexia, bad twist, ice craving, and intolerance to diverse smells or tastes. So this is another associated symptoms with Ptyalism gravidarum. Nausea, vomiting, bad taste, anorexia, ice craving, and intolerance to diverse smells or tastes. Some patients report being awakened by the excessive salivation. And while she is asleep, she is awakened because of this excessive salivary secretions. When you do examination for the parotid and submandibular gland, you may find the parotid and submandibular glands swollen, maybe swollen due to enlargement of the glands and the local vasodilatation. So you may find enlargement of these glands and local vasodilatation. The tongue also may be congested, red in color, swollen. So what about the diagnosis? The diagnosis mainly depends on the clinical presentation. The patient coming to you complaining of increased salivary secretions. Doctors, please help me. Okay? It is something irritating my life. I have some social difficulties. I have speech impairment. So you should help her. Okay? But physician must always rule out simple nausea related to pregnancy, hyperemesis gravidarum, and the eating disorder like anorexia nervosa or bulimia. Any complementary tests you should do for Ptyalism gravidarum? No. No complementary tests are required. Except in the event of concomitant hyperemesis gravidarum. So if the condition associated with hyperemesis gravidarum, you should do many investigations, as you know from the previous lecture of hyperemesis gravidarum. Otherwise, there is no complementary test if the condition restricted for Ptyalism gravidarum or increased salivary secretion. So, if there is expected biochemical or electrolyte disturbance, no. No abnormalities are expected in biochemical or electrolyte test. So, there is no complementary test of such condition. Okay? So, diagnosis mainly depend on the clinical presentation. Salivary gland ultrasound may reveal enlargement of these glands. If you did ultrasound on the salivary gland, could be enlarged. Okay. What about outcome and prognosis and the recurrence of such a condition? Some authors found an increased incidence of low birth weight, probably related to low maternal weight gain and prematurity. But others have found no association with worse fetal, neonatal, or maternal outcome. And this is the majority of studies suggesting that this problem has no worse fetal, neonatal, or maternal outcome. So, no complications of such condition as regard the mother or fetus. This is most of the studies, but some studies suggest that low birth weight may happen due to low maternal weight gain and prematurity. Okay, what else you should tell the woman about this? Women must be warned that they have higher probability of suffering from Ptyalism Gravidarum again in a future pregnancy. Okay? You should tell her that the next pregnancy you may complain of such a condition again. What about the management of Ptyalism Gravidarum? Ptyalism Gravidarum is a self-limited disorder associated with pregnancy. It may improve or persist during pregnancy. Usually it resolves during the second trimester or at delivery, but in rare cases it may persist as long as 1 month postpartum, as I said before. So it is self-limited problem? Yeah, it is self-limited problem. The condition start early in pregnancy in the first trimester? Yes. And may resolve in second trimester. But in some patients, it extends all over the pregnancy and even 1 month postpartum. Okay? Okay. So many therapies have been attempted to reduce symptoms. This is the main target, to reduce symptoms, because it is irritating for any pregnant woman. But the problem is their efficacy, the efficacy of this treatment is questionable and highly variable. Okay, there is some conservative measures, like what? Like consumption. You advise the pregnant woman of consumption of hard, low sugar candies. Also chewing lower sugar gums. So, consumption of hard candies, chewing gums, eating dry toasted bread or crackers, biscuits, frequent drinks of still unflavored water. Also, she can use lemon drops or oral lozenges to avoid the bad taste she's complaining of. So, this is conservative measures. Okay, what else in the management? Some patients submitted to hypnosis, acupuncture, or other alternative treatments such as chiropractic therapy, the manual therapy, resulting in either no effect at all or complete resolution of symptoms. So some pregnant women may improve with such measures, others has no improvement. Okay? So the use of hypnosis, acupuncture, or chiropractic therapy. Chiropractic therapy, by the way, depends on the manual therapy. Some there is some diseases can be managed with manual therapy using hands and certain movement like massage or something. This is the chiropractic therapy. There is a uh, uh, specialist in such field. Okay, so it may improve the condition or may have no improvement at all. What about herbal agents? Some herbal agents have been used, including Alpinia oxyphila, which is a traditional Chinese medication used for helping digestion and antidiuresis and salivation restraint, decrease the urine output, and decrease salivary secretion. So these herbal agents tried by some, but not only the efficacy of this treatment is inconclusive, but also its safety in pregnancy is still to be determined. So this herbal agent, I can't say it's safe because there is no studies up to now, enough studies to say yes, it is safe. So its safety should be determined. Also, its efficacy of uh, is not yet conclusive. Okay, so this is about the herbal agents like Albania, Rosifalla. Then the role of medications in management of Ptyalism Gravidarum. Medication used to treat pregnancy-related sickness has been widely used to treat this condition, such as the combination of doxylamine and the pyridoxine. This is a very common combination used in nausea and vomiting during pregnancy. Also can be used in such condition, like Vomiprake in certain countries. This is the name of this drug in certain countries, containing doxylamine and pyridoxine. Okay. Also, metoclopramide, what is called brembran in certain countries, metoclopramide or others, used for nausea and vomiting during pregnancy, and also can be used for Ptyalism gravidarum. Even so, the rule in improving Ptyalism gravidarum symptom is not clear. It may relieve nausea, which is quite commonly associated with this disorder and considered safe during pregnancy. What else as regards the medications? Other pharmacological agents have been used to reduce saliva production and or relieve symptoms such as barbiturates, phenothiazine, or scopolamine. Okay, we know barbiturates, phenothiazine, and scopolamine. Scopolamine, by the way, anticholinergic class of drug, and you can use it in the form of tablet or patch. Skin patch, as in this picture, as you see here, can be easily used. Clean the area post-auricular, should be applied for this area. Hairless skin, okay, don't apply it on a hairy area, on a hairless area. Clean, dry it quietly, then apply the patch. I can apply the patch post-auricular, keep it for 72 hours. Then, if you need to continue treatment, use another patch on the other post-auricular in the other ear, behind the other ear. Okay? So if you use post-auricular in one ear for 3 days, then continue with another patch post-auricular of the other ear. Okay? It can work for 72 hours, as I said. It's easy method, can be done easily. This is scopolamine. Okay, so we have the barbiturate, the phenocyasin, or scopolamine in the form of tablet or patch, as I said, as is seen in this picture. Unfortunately, the evidence of the efficacy of this treatment is sparse, and many patients keep their symptoms until complete spontaneous resolution of the disorder. So it may help some pregnant women, and it may not help others. Lastly, in medication, there is a trial for the use of clonidine hydrochloride. Clonidine hydrochloride is an antihypertensive drug, but one of its side effects is dry mouth. So it can be used for this side effect because it decreases the salivary secretion. And this is considered the dry mouth is one of the side effects of this drug, but it is benefit in this condition of sialorrhea or Ptyalism gravidarum. The dose of clonidine hydrochloride up to 0.1 milligram daily can be safely given to pregnant women, but further studies are needed to evaluate the efficacy of this treatment for Ptyalism gravidarum. Okay? Any medications used at the end of this lecture, we know that the parasympathetic is responsible for increased salivary secretion. So if we try to block this parasympathetic action by anticholinergic drugs or disrupting the sympathetic innervation or impulses, we can decrease the salivary secretion. And we know that the salivary gland under control of autonomic nervous system, and vagal tone plays an important role in secretions of the salivary gland. Okay, so at the end of this lecture, when a pregnant lady came complaining of increased salivary secretion, you should advise her by certain conservative measures, like what? Like chewing gum, using low sugar candy, hard crackers, or biscuits, or toast. Okay, drinking unflavored water, small, frequent unflavored water. Can use lozenges, can use few lemon drops. Okay, if this improves the condition, you can go on to hypnosis or acupuncture if it is available. If not, you may use some medications like combination of pyridoxine and doxylamine, which is used for nausea and vomiting in early pregnancy and also may improve this condition. If not improved, you can go for scopolamine skin patch post-auricular, which can work for 72 hours, or you may use antihypertensive clonidine hydrochloride, which is under trial for treatment of Ptyalism gravidarum because it's one of its side effects is dry mouth and use it for this target. You may tell me that this may lower the blood pressure. It may lower blood pressure about 9 millimercury, but it is proved that it is safe during pregnancy, but it's still under trial for use during pregnancy for Ptyalism gravidarum. This is the chlorine hydrochloride. So I prefer to use conservative measures and to use scopolamine skin patch. This is or the combination of pyridoxine and doxylamine. This is the end of this lecture. I hope it was beneficial for you and for any pregnant lady. This is my box published on Amazon. You can find it via this link. I write it in a comment. Also, you can find other lecture related to obstetrics and gynecology through the link on YouTube. I'll put it in another comment. Thank you, everybody. My best wishes for all of you.